Hello, I'm Ronald Day, Associate Vice President of the David Rothenberg Center for Public Policy at the Fortune Society, and welcome to Both Sides of the Bars, a discussion-driven show that examines the criminal justice system from various perspectives, including from those most impacted by the system. We discuss critical questions about how the current system works, its intersections with social justice, and highlight the efforts that are being made to improve the lives of everyone that is affected by it. We ask you, the viewer, to spread the word about Both Sides of the Bars and share your comments with us on Twitter at the Fortune Society. And today we're going to be talking about a very important issue, the public health implications of mass incarceration. And we have with us two wonderful guests, David Cloud and Anibal Cortes. So I'm going to read some of your bio, David, for our audience. So David is a senior program associate in Vera's substance use and mental health program. His work broadly focuses on the intersection of health and criminal justice system. He currently leads Vera Institute's Reform for Healthy Communities initiative, which aims to reduce health disparities in communities most affected by mass incarceration through public health education, coalition building, public briefings, and policy publications. And David is also he has his law degree from Villanova Law School and has an MPH from the Mailman School of Public Health at Columbia University. Thank you, David, for being on the show with us.
Thanks for having me.
And Anibal, who works at the Fortune Society, joined Fortune as a family service specialist in July 2014. His primary responsibilities are empowering parents to establish a positive, healthy, supportive relationship with their children through the use of collaborative treatment strategies and effective use of Fortune services. In 2014, he too graduated from Columbia University's Mailman School of Public Health with an MPH in epidemiology and a certificate in comparative effectiveness outcomes research. So thank you, Anibal, for being on the show.
Thank you.
And so, public health and mass incarceration, I think I said a mouthful. And so one of the ways that I would like to open up this conversation is just by having our viewers get an understanding of mass incarceration, because we know that the criminal justice system has grown pretty substantially over the last 40 years or so. And so there's a lot of talk, a lot of buzz in the community about mass incarceration, but we want to connect public health to mass incarceration. So how is mass incarceration defined insofar as public health is concerned? David?
Sure. So, I mean, I think the important thing to realize, which you touched on, is just the dramatic, sustained growth of correctional populations over the past 40 years. So you unpack that and you look at where that's been concentrated, the people it's hit the hardest.
Yeah.
There's a history in those neighborhoods of other types of socioeconomic inequities. And when you look at the scale of incarceration and how it's come across generations, you can start to see how it's impacted a particular segment of the population. Yeah. Namely, a lot of jails and prisons act as warehouses for individuals who have serious mental illness, addiction, and continuously churning those people through the system. We have to also understand that the conditions of confinement that they're exposed to, overcrowding, violence, often poor access to health care, and then releasing them back into the community. So that kind of continuous cycle can create risk to the individuals who are exposed to them directly, but a lot of those experiences, that trauma, that disparity is brought back to the communities too. So we just have to think of the justice system as kind of a conduit for perpetuating other inequities.
Got it.
Yeah.
If I'd like to just add one
Sure.
thing.
Sure.
So I think the one thing that really stands out to me about mass incarceration as a formerly incarcerated person is what Bruce Western said. Mass incarceration is marked by the incarceration of populations of people. So there was a movement from locking up individuals for crimes to locking up a population, like a targeted minority population from the inner city. And that's important because this problem has to be thought of as something beyond the individual. It has to be thought of in terms of a population problem, a national problem.
Yes.
and it's unique historically.
Exactly.
So that would be the only thing I would like to add.
Exactly. And you wrote a report, David, called On Life Support, Mass Incarceration, right, in public health. So can you tell us about some of the findings and some of the research that is out there around mass incarceration in public health?
So the goal of that initiative, Justice Reform for Healthy Communities, is to educate people on the various ways that this system can negatively impact health.
Yes.
So whether we're talking about mental health, HIV, infectious disease, chronic disease, we know that there are detrimental outcomes associated with certain policing practices, with conditions of confinement. What we wanted to do was to not just reach out to people who are interested in criminal justice reform, criminal justice policymakers, but also extend this knowledge to people who work in the health community. Because, I mean, from our perspective, the overuse of jails and criminal justice actors is directly tied to inadequacies of other types of public health and social service systems. So from our perspective, this word needs to get out there to encourage folks in those sectors to take action, to be a part of the solution.
Exactly. And how do you, Anibal, see the intersection between the work that you're doing at Fortune and mass incarceration and the public health implications? Because we offer substance use services, for example. We offer, we have a mental health clinic. And so there's that relationship, and we want our public to have a much better understanding of it.
So I work in the family services unit. And mass incarceration is negatively impacting Black and Latino families, predominantly Black families. Research has been done that shows that there's an increase in homelessness, increases in food insecurity, increases in behavioral problems. Paternal incarceration is negatively impacting these families. And so when I see people who come in from the criminal justice system, I kind of identify with those problems. And it's really good to be able to kind of walk them around the corner to a substance abuse or drug treatment, substance use, and mental health, or downstairs to employment services, or even to have a heart-to-heart talk about what does it mean to be a formerly incarcerated person? How does that impact your family? How do you reunite with your child? How do you address issues of stigma? So this is important stuff, and it's intergenerational. So looking at it from that perspective, you can see that parents who are coming home from prison do need a lot of support, and they're interested in it, and some information, some knowledge. Like you said, this is looking at that community from a different perspective. Kind of at the individual or at the family level.
And just to echo one point, I think it's important for people to understand, we talk about public health. I think a lot of people think about health, and they think about doctors, and they think about hospitals, and they think about nutrition. Those things are critical. But what we know is that if you're talking about the health of a population, there are things that are equally, if not more important. And that includes things like education, housing, basic social kind of determinants of health. And that's where a lot of the research, a lot about what the report talks about, what Anibal was highlighting, is that the way the system exists now, it's not just about arresting and incarcerating to keep people away from communities. There's a lot of collateral consequences, as they're commonly talked about, and those have bearings on people's health.
Got it. And so there's a lot of discussion taking place in the policy arena right now around trying to end mass incarceration. Hillary Clinton has made comments about it. Now, even though, like, while Bill Clinton was president, he actually was, the changes in the laws actually helped perpetuate mass incarceration by building more prisons and so forth. And so now a lot of politicians seem to realize that we need to scale back on this. But we want folks in the community and politicians to understand how the public health consequences that are associated with it. So what do you say, David, to that particular perspective?
First of all, I mean, I think it's worth being excited about that there's actually one thing that Republicans and Democrats can finally agree on is like this is one issue. They're coming at it from different angles, I think different priorities, different solutions, but this is where we are, so let's move forward. That said, I think, you know, people who are talking about it and want to do something serious about it takes a deep dive, requires a deep dive into more systemic issues. So, of course, we need to think about our laws. We arrest too many people, we send them to prison for too long. There's a lot of discretion at the prosecutorial level. There's a lot of big decisions made that keep people in the system for a long time. I think really picking apart the entire continuum of the criminal justice system is very important. That said, I also think that we have to think about kind of intersectoral solutions, so involving public health and other agencies to be part of the solution. So a lot of what we think about is curbing kind of the flow of people, because if you think about who gets caught up in Rikers Island, who gets caught up in jail, it's most of the time it's like very low level stuff that just builds up and stacks up on top of people. So we have to think of like better, like technocratic but really programmatic mechanisms that challenge police and other people to reform themselves in a way that doesn't impede the efforts of other public health agencies. So, you know, rather than directing them to, you know, you get arrested, you see a judge, and you're off to Rikers, there should be kind of interventions to intercept people. If they're sick, get them to services in the community, get them to their family. I think that kind of front-end area is one that needs a lot of attention.
Exactly. And so, you know, Anibal, you mentioned that you were formerly incarcerated, so you also did some work while you were inside. And my understanding is that you actually helped introduce a public health curriculum into one of the facilities that you were in. And why is that something that you would consider important?
Well, it's another leg, another aspect to add to what David has added, which is the substance use and mental health, and even the overuse of prisons, reducing that. But there are people within the prisons who they need an education. They want an education. That's a concentration of all these things that we're talking about, and that's where an intervention needs to be made. So I was fortunate enough to get an associate's and a bachelor's through the Bar College Prison Initiative. But before that, I worked with an HIV and AIDS peer organization that was sponsored by the AIDS Institute. I was able to get a certificate from the Department of Labor as a counselor. So even if I wouldn't have gotten my college education, with that alone, I would have been viably employable when I got out. But with those two things, with the degree and what I saw was happening in the classrooms, so people were asking questions that went beyond the germ, like what was happening in our communities. Why is it that 85% of the people who are coming to prison are, it's the same neighborhoods where you have HIV concentrated, where you have homelessness concentrated, where you have a lot of violence. What's the story with that? So I was fortunate, I was given an opportunity to come up with an idea for a practicum, a master's level kind of intervention. And I thought that public health would offer an important addition to the liberal arts curriculum. And, you know, just wanted to know what was epidemiology, what was public health, what was biostatistics, how could I go out and do some community-based interventions, what did that mean? And I'm not unique in that. It's quite a number of people
So
like
that peer education that you received inside obviously was valuable for you as you made the transition.
Extremely.
Yeah. And you mentioned in the report, David, also that community health workers have been used, peer specialists have been used, there's the transitions clinic and so forth, and there's a lot of work that's being done to try to help educate the community to bring about higher levels of awareness. So, you know, what do you say to that issue about using community health workers, particularly those who themselves might be able to relate more to the community based upon their own either criminal justice system involvement, or they might be in recovery, or they might have had some other issues and can empathize with folks?
I'll speak to the prison context. So we know in the country there's about 650, 700,000 people a year that come home. That period of transition, from an epidemiologists have studied, we know that from a health perspective is a very risky one. There's a high risk of death, high risk of injury. And when they release you, they may prepare you for some things, but when you get out, you know, with like a job, family, healthcare is important, but it may not rise to the top. So this transition clinic model that you mentioned, what that program is, it was started out in California, but they trained men and women who were inside to be peer advocates, community health workers. So they go through a curriculum with the community college in San Francisco. They get credentialed, and what they essentially do is help people understand their diagnoses, where they can go in the community when they get out. It's an in-reach model, so they're going to see the same folks that were talking to them when they're inside, when they get outside. So there's that relationship, there's that trust. That type of model has been evaluated, you know, in rigorous studies and shown to be effective in preventing folks from coming back and helping them use vital kind of primary care services. So it's something we should really strengthen. I mean, we have a lot of people who need work. I mean, it would be excellent if the local universities around here would get together with the health departments and think about some type of credentialing program to just really, really expand.
Exactly.
Because
make it
that's
much more robust.
That's the type of service capacity that is really missing for that key transition.
And just to add to what David is saying, I think, you know, there's a common misconception that prison is just a place where there's an intense pooling of risk. There's actually an intense group of people who want to solve the problems, like you said before. You know, the people who are most impacted by these mass incarceration challenges are in the correctional facilities, and they want to get involved. So, you know, tapping into them as peer educators. I mean, of course, there's some self-selection, but I think that that's good because they're from the community and they have a certain validity and insight that they can actually add to the knowledge. They can add to the knowledge. And this is what I think a lot of people should take a second look at, how important it is not to think about this in terms of education on its own terms, quality education on its own terms, not just public health or community health work for incarcerated, but just community health work in general. So that it's broadly applicable. That's all I just,
Got it. I mean, and one thing is that we have a tendency of thinking about incarceration as an individual level problem rather than a community level problem, which you both alluded to already. Because once you incarcerate not just an individual, there are these significant effects on the family. And so there's a lot of research about there as well. So, and then your report kind of alludes to that, how, you know, there are all of these ramifications and all of these implications. So can you speak a little bit to the implications as it relates to how communities are less healthy when you have individuals, be they men or women, that end up in the criminal justice system?
Sure. I mean, I think you hit on it. It's the family structure, those dynamics that start to get torn apart by decades of incarceration. You know, parents with children, children with parents who go through the system. And actually, there's been some pretty important and impressive work done on infant mortality rates. So looking at these models of what if we kept the incarceration rate in the United States similar to what it was in the 1970s. What would the difference be between infant mortality, so babies who died before they should, between black and white populations? And what you see is like the disparity over mass incarceration. It would have been much, the gap would have been much more narrow. So I mean, I think you can start to think about those kind of metrics, like infant mortality, and start to really lets the magnitude of this issue sink in when you're starting to see its effect in things like that are really key indicators of how healthy and how well a community is doing.
You want to add to that?
I mean, you know, infant mortality is something that definitely is near and dear to me, in the sense that that's kind of what got me going into public health as well. I wrote a paper on for my bachelor's degree on that. What were the community responses to high infant mortality rates in New York City? And what struck me was that I didn't know, like my daughter wasn't, she didn't die or anything, but she was born premature, she was born underweight, and I was asking why couldn't I get answers? And turns out that public health offered some really important answers to that. And now thinking about it intergenerationally, you know, the homelessness that my family has gone through, the food insecurity, you know, dropping out of school while I'm getting a degree. These are kind of paradoxes and stuff that, on the one hand, public health kind of really highlights and underscores for me, but I think it's really important what you're saying. That's a key indicator. And another thing, just going back to the report that you wrote, which I think is fantastic, there's a small section on political capital and what the transference of bodies means politically to these communities that are intensely policed and mass incarcerated. And that's great. I don't know if you want to say something about that.
No, I mean, I just think disenfranchisement is such a huge thing. And for all of this, the power to have the ability to say and vote on political issues about things that directly affect your community. I mean, that's just a fundamental, basic thing. And our system of mass incarceration has taken that away from so many people.
There was a graph on life support that I thought was fantastic that I would like for you to speak to as well. And it was, you looked at how as mental health facilities closed over the years, how that has coincided with mass incarceration. So as facilities close and there was nowhere to send people who suffer from mental illness, the prison population was increasing at the same time. So I thought that was a pretty dynamic illustration.
Yeah, that's a graph from a guy named Bernie Harcourt, who's at Columbia Law School. It's his graph. And the telling story is that we know in the late 50s, we had a major transformation in mental health policy. We decided that, and we learned that many of the state hospitals were pretty egregious places. And there was new medications, there was a new movement for community-based mental health care. We moved in that direction. We started shutting down the hospitals in mass numbers. At the same time, however, we entered a criminal justice realm where our values said, rehabilitation is not the function anymore. It's punishment, it's retribution. And we see the rise, those two things. So more people are visible, more people are in the community, but more people are being punished. And all the while also we saw dramatic cuts to social services, mental health services. So that promise that deinstitutionalization was hinged on, this community health, has never really been fully realized. There's a lot of good effort, and so, I mean, it's a kind of at the core of why we see so many people with profound and very serious mental illnesses just get ensnared and trapped in the jail and prison system.
I just want to say that I think that there's a cautionary tale in what you're sharing with us. So deinstitutionalization was a great idea, it was a great movement. The criticism of rehabilitation as failing, this was a liberal idea, but it was turned. And so today we find ourselves at an important juncture, right? But we're talking about deinstitutionalizing, right? Shrinking the population that's going into prison, not reducing the amount of usage of jails and prisons, and this kind of synergy that we see between the two parties. And I think personally, as someone who's was in the system as Bill Clinton kind of eliminated the college for prisoners, and now that I see the sort of other side of it, he's retracting on that. I'm just cautious as to what does it mean? How are we going to institutionalize? And what's the benefit? Like you said, I think you said in an earlier conversation, how is that going to be accountable to these very communities, right? Because it's important ethically. I mean, I really appreciate what you're saying in terms of ethics.
And we have a couple of minutes left, so I would like to, as we generally do, to get some policy recommendations. So what is it that you recommend, the Vera Institute recommends, happen to try to address this issue of mass incarceration and public health?
Again, it goes back to changing the laws, policies, and practices that got us there in the first place. But I do think there's, for the folks who have such serious health issues, there's a real opportunity with Obamacare, the Affordable Care Act, to rethink structures of enrolling folks when they do hit the system, building kind of fundable new programs and structures at the front door of the justice system and the back door system. The front door that can intercept them and keep them from going there in the first place, and at the back door to help them get into the services that they need, so they can get on with their lives.
And Anibal, what do you recommend?
Higher education, quality education. In thinking about it in terms of a public health continuum, education before a person has any contact, quality education before a person has contact with the criminal justice system, quality education during a time of incarceration, because there's a lot of benefit that comes from that, and making it easier for folks who are coming out and do want to make a change and are serious about it, getting into college, because education is such a key part of this. We know that based on the research, high school, dropouts, black men have such a high rate of incarceration, and that's a population level problem. And I believe we can fix that all along that continuum.
Sure.
So that's my contribution.
Yeah. You said one other thing in the report that I'd like to get a comment about. You said human health is determined by a range of socioeconomic and political forces that are beyond the control of the individual. A lot of times we think, we're in control of what happens, but there are all of these different factors, like the criminal justice system and so forth, that bring about certain implications. But what do you have to say quickly to that?
It's an important point I think we both have hit on today. You have to think about, if you're going to do something about the public health consequences, you have to think about the things he was just talking about: education, housing. Really, just think about it most simplistically as community capacity.
Yes.
So what's missing? Why are we overusing the criminal justice system?
Exactly.
Why are we overusing it?
Exactly.
And to the extent that we're overusing it, how should we redistribute those resources to other sectors in the communities that actually help advance human potential rather than bring it down?
And there's a bunch of redistribution that can happen, because we know that there's a lot of money that's going into the criminal justice system that could go into public health, that could go into housing, that could go into education, and so forth. So, I just want to thank you, Anibal, for coming on the show today. Thank you, David, for the work that you've been doing with Vera. We value your partnership and appreciate it.
Thank you very much.
So, thank you. So, with that, we're going to close out both sides of the bars today. Thank you to our guests, David, Cloud, and Anibal Cortes, for joining us on both sides of the bars today. And thank you in TV land for joining us as well. If you're interested in finding out more about the Fortune Society, please check us out on the website at fortunesociety.org or on our Facebook page by typing in the Fortune Society. This is Ronald Day as we critically look at both sides of the bars. Thank you.